Why is it that the press, the media, to a large extent, and so many politicians, including Democratic politicians, say that it's a centrist position to say that there's no way that we can have free health care for all Americans, there's no way we can have free college education for all Americans, and there's no way we can fund a Green New Deal? Why is that centrist? These are positions that more than half, in the case of health care, more than 70%, in the case of free education, well over 65% of all Americans support. So, I mean, if you're just looking at it like a mathematician, okay, if you've got, it's not a plurality, it's a majority. More than half of Americans want Medicare for all, want free college for all, very straightforward stuff, and frankly would like a Green New Deal. Now, the details of the Green New Deal are not really clear enough. The public polling on that is really all that accurate because we haven't had much of a public debate about it. But then into this confusion steps Howard Schultz. If you want to see Donald Trump reelected as president, then throw some money into a Howard Schultz campaign, right? This guy, he says he's a Democrat for life. He bought Starbucks, or came in as CEO of Starbucks. Not sure if he bought it or not, but how the whole story. But anyhow, he came into Starbucks when it was a little company with 100 employees and just a couple of stores. They didn't even sell coffee by the cup. They sold beans, coffee beans. And he came in and he built this into a worldwide empire. And, good on him. And we need to acknowledge that. It was a great effort. And he's been largely socially progressive. But this whole thing of, well, I'm socially progressive, but fiscally conservative. What the hell does that mean? Why is it that every developed country in the world, you look at the 34 Organization of Economic Cooperation and Development countries, the 34 OECD countries, the 34 countries that, and this includes countries as small as Costa Rica, the 34 countries who are the most developed functioning democracies in the world. You look at those 34 countries, and 33 of them have health care as a right for all their citizens. Switzerland has a system. It's not government run, but it's entirely nonprofit. To be a hospital in Switzerland, you have to be nonprofit. To be a health insurance company in Switzerland, you have to be nonprofit. So, they run very much like a government would, where the first mission is not to maximize shareholder value. The first mission is to provide a needed service to the people who are customers. Switzerland is kind of the outlier among the 34 OECD countries. Every other one of those countries has a program that the government runs. Now, some of them, like the UK's National Health Service, the government actually owns the hospitals and employs the doctors. With systems like Canada's or France's, the government doesn't own hospitals and doesn't employ doctors. Instead, they just write the checks. They pay the bills. They play the role of health insurance company. It's what happens here in the United States with Medicare and Medicaid. These are called single-payer systems. We have one here. We also have a socialized medicine system in the United States. The Trump administration and Republicans for years and years have been doing everything they can to take it apart and to damage it. It's called the Veterans Administration, or the VA program, right? The Veterans Administration Hospital. This is socialized medicine. But now Howard Schultz is coming along, and he's got a book out, so he's doing his book tour. And the question in my mind is he just doing this to jack sales of his book? Or is he doing this because he's seriously considering a run for president, which is essentially what he said on 60 Minutes last night? And by the way, the guy that he's hired to manage his PR is Steve Schmidt. Steve Schmidt, the guy, who used to run the John McCain campaign. Well, when he ran the John McCain campaign, he was actually working for this massive public relations company. It's called Edelman. Schmidt got to know Schultz through Edelman's partnership with Starbucks, writes Brian Schwartz over at CNBC. So Edelman is a PR company that Schwartz had hired to promote Starbucks, and Schmidt worked for back when John McCain hired them. In October, Schultz also hired Cheryl Cook, longtime executive vice president at Edelman. Again, the guys who ran John McCain's campaign are now working with Howard Schultz. I mean, you know, if you recall, in the 2000 election, Ralph Nader got more votes in Florida than, I mean, he got, what, 97,000 votes, as I recall? Maybe it was 79,000. It was something like that. Fewer than 100,000, but certainly more than the 500 or so that George W. Bush claimed he won Florida by. The subsequent recount showed that actually Al Gore won Florida by at least 500 or 1,000 votes, depending on whether you counted, you know, intention of the voter and all that kind of stuff. But so, you know, we know that the Supreme Court stole the election in 2000 from Al Gore and gave it to George W. Bush. I mean, it's just, but had Ralph Nader not been in that race, there wouldn't, you know, they couldn't have stolen Florida. And there have been a number of other cases of this, you know, John Anderson and others. By the way, the second hour of our program, the full hour, Congressman Ro Khanna of California is going to be here taking your calls. And you know, if you want to lobby him about something or whatever, give it, you know, you can give him a shout here in the second hour. In our third hour, Medea Benjamin, the founder of Code Pink and Global Exchange, will be with us. We're going to be talking about Venezuela and getting into an in-depth thing about that. So political strategists from both sides of the aisle say that by enlisting the help of this PR team, that's Steve Schmidt and Cheryl Cook, that Schultz is clearly signaling that he's exploring a run for president. And then he says, this is what he said on 60 Minutes. He says, every American deserves the right to have access. Access is the magic word here, right? We all have access to quality health care. If you're bleeding, you can show up at an emergency room. That's a law that Ronald Reagan got passed through Congress in 1986, as I recall. Hospital emergency rooms can't turn you down. So, you know, right now, all Americans have access to quality health care under certain circumstances, like if they're bleeding. So anyhow, back to Howard Schultz. He says, every American deserves the right to have access to quality health care. But what the Democrats are proposing is something that is as false as the wall, and that is free health care for all, which the country cannot afford. If we can't afford it, why are we paying an extra $500 billion a year in profit margin to giant insurance companies like United Healthcare and Aetna to manage it for us? I mean, if we can't afford it, why are we letting them skim 10, 20% off the top of every healthcare dollar spent in America, or virtually every? Why are we letting the drug companies rip us off when other countries don't allow them to rip them off? Why are we promoting for-profit hospitals, which are skimming money off the top like there's no tomorrow, when other countries require hospitals to be not-for-profits? Why are we doing this? Well, we're doing this very simply because our political class, including people like Howard Schultz, have been wholly bought and paid for by the billionaires who own the health insurance companies or run the health insurance companies, people like Stephen Hemsley of United Healthcare, and the billionaires who own and run the hospitals, people like Rick Scott down in Florida, who owned one of the biggest hospital chains until he was busted for fraud and had to pay a multi-hundred million dollar fine. So he took his hundreds of millions of dollars and went off and became governor of Florida. Now he's the senator. This is how they do it. They end up owning politicians. And then once they own the politicians, what do? Well, here's an example. Jordan Barab, writing for Raw Story. This is from the DC report. You ever heard of beryllium? Beryllium is a metal. It's part of the periodic table. It's a metal. It is poisonous. It's in the cadmium kind of part of the, there's a word for that part of the periodic table. And like cadmium, it causes cancer. It's a carcinogen. And in this report, they tell the story of this one guy. His name is Davis is his last name. Wardell Davis. And he was 24 years old, and for a year he worked at a Navy contractor where they were blasting coal dust off ships that had hauled this coal slag. And that blasting produced enormous amounts of beryllium in the air, which he inhaled. A couple of years later, the guy is dying, can't breathe. Beryllium poisoning. So the Obama administration put forward a plan to tighten that. Well, it became the rules. This is OSHA's standard to protect workers from the disabling and deadly effects of beryllium exposure. They've been working on this new standard for 20 years. It was an agreement between the main beryllium producer, Materion, and the United Steelworkers, who want this protection for their union members. It's going to cost industry about $12 million a year, about $1,000 a worker, to prevent workers from ending up with cancer, lung cancer, deadly, painful lung cancer. And who's leading the charge to weaken the protections? A congressman by the name of Bradley Byrne, Republican from Alabama. He's chair of the subcommittee on workforce protection, or he was until the Democrats came in. He wrote to the U.S. Office of Management and Budget, asking them to weaken the workers' protections. The article, quote, much of Byrne's letter was taken word for word from comments submitted by the ABMA's lobbying firm, Squire Patton Boggs. Former senior partner at Patton Boggs is a guy named Mark Cohen. He was the head of OSHA under Reagan. And he's advising Byrne and Robert Whitman, the Republican from Virginia, in how to, do away with these workplace protections so that the companies can save $1,000 per worker and the workers can end up with lung cancer. This all, increases GDP, right? Because when somebody gets cancer, that increases GDP. It's a $500,000 diagnosis for the hospitals, for the insurance companies, for the doctors, for everybody, Economic activity increases when you get cancer, don't you know? Radical Republicans doing this. This is the kind, if you got somebody like Howard Schultz, an independent, in this race, you're going to see more of this kind of thing because you're going to end up electing Republicans.